Is your employee injured at work? If you are unsure what duties they can perform or wonder when they can go back to work, a functional capacity evaluation can help. What is a functional capacity evaluation? A functional capacity evaluation is a comprehensive assessment of an individual's health conditions and work capacity when one is injured. There are two types of functional capacity evaluations: physical and psychological. The type of functional assessment an injured worker undergoes depends on the nature of their workplace injury and claim. A physical functional capacity evaluation is usually conducted by an occupational therapist, a physiotherapist, or an exercise physiologist. The physical evaluation aims to assess what the worker can physically do based on their job tasks, identify barriers affecting recovery like pain, weakness, physiological and psychosocial factors. A psychological functional assessment is conducted by a psychologist focusing on mental health, cognitive and behavioral factors. The psychological evaluation aims to understand the psychological concerns of an injured worker and assess the cognitive function and social skills of the injured worker. Both evaluations use standardized testing to gauge the worker's physical and psychological capacity and limitations. The results can provide an accurate guide to suitable duties for a safe return to work. When do you need a functional capacity evaluation? Here are a few signs you need a functional capacity evaluation. 1. The recovery progress of your injured employee has plateaued and you're not seeing improvements in their health conditions. 2. You want to know whether or when they can perform their pre-injury duties. 3. You have difficulty obtaining a medical update from the injured person's treating providers. 4. Additional reassurance is needed for claim progression, for example, to move forward with the next graded suitable duties. If you've been experiencing any of the issues above, a functional capacity evaluation may help. The functional assessment provides you with a detailed report featuring evidence of the worker's current capacity and helps you make an informed decision for their return to work. What to expect during and after a functional capacity evaluation. The entire process of a functional assessment can take up to 3 hours. During the evaluation, the assessor will interview the worker to discuss their general health concerns, including injury history, current health status, medical concerns, and medication use. The assessor will also ask questions to understand how the injury affects the worker's daily activities and what they find particularly difficult. According to the worker's injury and specific job demands, the assessor will then evaluate the functional abilities of the worker. In a physical evaluation, this includes range of movement, lifting and carrying capacity, and other tests. For a psychological evaluation, current functioning such as sleep, memory, cognitive functioning, and social interactions may be assessed. Once the functional assessment is completed, a detailed report will follow within 5 business days. The report will specify past and current medical conditions of the worker, as well as their injury circumstances, objective and subjective measurements of the current health conditions, factors affecting their performance, and recommendations on suitable duties and treatment. How does a functional capacity assessment support your workers' compensation claim? In New South Wales, functional capacity evaluations are covered under workers' compensation and can be requested by any member of the support team, including the treating doctor, the employer, the insurer, or other healthcare professionals. Functional capacity assessments play a vital role in workplace rehabilitation by providing a clear understanding of the worker's current capacity, suitable duties, and any work restrictions. The assessment report also serves as a valuable tool in assisting the nominated treating doctor to accurately note medical certificate restrictions. Together, the insights help both employers and employees make informed decisions about recovery and return to work planning, minimizing risk and supporting a structured reintegration into the workforce. Sounds like something you need? Contact AusRehab to book a functional capacity evaluation today.